On December 7, 2013, the Eastern and Southern African region witnessed history in the making. Ministers of Education and Health from 20 countries came together to commit to providing comprehensive sexuality education and sexual reproductive health services, ensuring that every adolescent and young person lives a full and healthy life. This became known as the Eastern and Southern African Commitment, or the ESA Commitment. Ministers committed to 8 targets that they wanted to accomplish by 2015 and 2020. As we look back over the 2 years, how far have we come? The ESA Commitment has become a platform that fosters collaboration across sectors, harmonizing related efforts at local, national, and international levels. It has also benefited from broad-based partnerships with development partners, civil society, parents, community leaders, religious leaders, and young people. 10 countries have established coordination mechanisms, developed joint work plans, and mobilized financial resources to implement the ESA Commitment. At least 15 countries have integrated sexuality education in primary and secondary schools. However, a number of countries have yet to fully integrate CSE at a national scale. In order to reach the 2020 targets, more will need to be done to strengthen the quality of delivery to ensure core, essential topics are included and are taught early. Achieving universal access to sexuality education also requires specific strategies for out-of-school youth. Civil society organizations and other youth-led networks have proven to be a vital part in engaging hard-to-reach communities. In addition, engaging journalists, parents, religious leaders, and communities at large have been critical to ensure there is support for sexuality education, enhancing overall understanding of the issues facing young people. 16 countries have a national strategy on CSE for out-of-school youth. However, further efforts are needed to strengthen programs that reach marginalized young people. Quality education and health outcomes require investment in teachers and health professionals to ensure that they are well trained, resourced, and supported. Every country has reported providing training programs on the delivery of CSE. However, efforts are still needed to capacitate teachers in transferring knowledge and skills to students. 17 countries currently have training programs for healthcare workers, yet more work is needed to ensure that training material is fully aligned to World Health Organization standards and are instituted within health ministries. Ministers under the ESA Commitment have specifically committed to integrate and scale up high-quality, youth-friendly sexual reproductive health services. 18 countries have costed national strategies to improve these services. In addition, 15 countries have reported offering a standard minimum package of youth-friendly sexual reproductive health services. However, the level of alignment and implementation of national standards according to the World Health Organization guidelines vary within and among countries. Recent reviews reveal limited progress on improvement of health services delivery, especially to the most vulnerable and marginalized populations. We are seeing an overall decline of new HIV infections across the region. However, this remains insufficient. Significant numbers of young people, particularly young women and young key populations, are still becoming newly infected. HIV knowledge is increasing slowly, but still remain low in the region. A recent study revealed that pregnancy almost always means an end to education for girls. Between 95 and 99% of girls who fall pregnant are out of school in many countries. Gender-based violence remains high across all countries. 1 in every 3 girls have been forced to have sex before the age of 18. This limits their ability to make choices regarding their sexual health. More than 1/3 of young women aged 20 and 24 have been married or in union before the age of 18. Although significant progress has been made in the short-term targets of the ESA Commitment, much more needs to be done. We need to prioritize increased access to CSE and SRH services to all girls and boys, regardless of who they are. Recognize that working together is better to support joint action. Invest in programs that encourage girls to remain in school. Ensure sexuality education and related health services are based on international standards and are implemented at a national scale. Strengthen child protection systems and standards that eliminate discrimination based on gender and enforce legislation to eliminate child marriage. Together, we have the duty to prepare and support adolescents and young people in making safe and healthy decisions about their life and future. Let us step up and deliver young people today. The time to act is now.